some of our chosen products from the AestheticSource portfolio, and their mechanisms of action and certain kinds of pigmented skins as well. So my name's Anna Baker. As I said, I'm an aesthetic nurse and trainer, and I'm also the clinical lead for AestheticSource. So I'll bringing you this webinar this morning, and we'll be covering a number of the products as we go through the slides in relation to the different brands that we have within our portfolio as well. So I'm also joined, as you heard, by Vicky Baker, who's our marketing manager. And as I say, any questions that you may have in terms of anything that we cover, please do type them into the chat box and we'll collate them and I'll answer all of them at the end of the session this morning. I will be covering quite a few independent studies as well initially, just to look at what the literature says about the different types of skin conditions that retinoids are particularly effective at treating. So if anybody would like copies of these papers, I'm very happy to send these out. I can certainly send them on to my colleagues in head office, and we can send them out to you if you like on request. Most of them are free to download, but it's not a problem to be able to send them on to you if you wish. So before we look at retinol specifically, I think it's useful just to remind ourselves where retinol as just one type of compound sits in the context of all of the other types of vitamin A derivatives that are out there and that are widely used perhaps within other types of formulations. So the paper and the reference on the left here, which is a paper from Mukherjee from 2006, I appreciate this is not the most recent of references, but this I think is still certainly one of the best papers, certainly the most comprehensive papers that are out there in terms of describing all the different functions of these vitamin A derivatives. And this particular diagram that I'm focusing on here, where my mouse is, has actually come from this paper. So just to appreciate again in terms of where retinol sits, we can consider retinol to be one of a number of first generation, so non-aromatic, vitamin A derivatives, if you like. So we also have retinaldehyde, we have tretinoin, isotretinoin, allotretinoin that fall within this first generation, what we call the non-aromatics in terms of vitamin A. When we talk about second generation or monoaromatics, we have atretinate, acetretin, and we also have third generation, which we consider to be polyaromatics, where we have adapalene, tazarotene, and also soletinoid as well. If we look at the table on the right-hand side of the screen, this has actually come from a slightly newer paper from Darlensky as a lead author in 2010. And as you can see, obviously classifies the vitamin A derivatives in a similar fashion by different generations respectively, but we can actually see that there are a number of newer retinoids in here specifically within the third generation, so the polyaromatics, bexarotene, and also we have arotenoid as well, so some slightly newer additions there. So when we consider obviously retinol, this will be our focus of the presentation. So we're talking specifically about an ingredient from the first generation, if you like, or the non-aromatics. So this is a paper that I actually found fairly recently. It is free to download. And it's a really interesting study from 2017 that gives a really nice, broad, overarching view of the different anti-aging benefits that we can expect when we use and work with retinol. So the specific strength that was worked with within this study was 0.4%, fairly small cohort of subjects used, as you can see, just 12 subjects, but nonetheless a very nice study. So we know, these outcomes have been very well demonstrated across the literature in terms of how retinol works and why it's such a popular ingredient. But we know that retinol ultimately targets 3 different types of skin cells, so epidermal keratinocytes, dermal endothelial cells, and also fibroblasts. We know with retinol as well, in many ways, irrespective of the strength that's used, that it's very effective at increasing the epidermal thickness, stimulating the keratinocyte proliferation, and also really helps to deliver a proven anti-aging benefit in terms of improving the environment, if you like, of the dermal extracellular matrix as well. We know that retinol as well is very effective at increasing dermal vascularity. So again, really helping to nurture and stimulate the production of those endothelial cells, and also specifically the production of type 1 collagen, fibronectin, and elastin, again, through directly stimulating the activity of those dermal fibroblasts. Looking more clinically, though, in terms of the visible outcomes of what retinol can achieve, we know it's an excellent ingredient in terms of improving the clarity, the appearance and the texture of things like pore size, signs of hyperpigmentation, particularly epidermal hyperpigmentation, dyschromias, acneic skin, and also a lot of the associated pathogenic causative